Hi, this is Christine Nguyen, and I'm doing a presentation on the ethics of healthcare information and communication technology, or ICT. This is for Dr. Kala Seal's MBAA 609 class from Loyola Marymount University. Now for the introduction. Technology changes the delivery of healthcare and the scientific understanding of the human body and diseases. Medical informatics has evolved very rapidly. Every physician or health professional in modern countries uses intelligent machines in their clinical practices. Information technology has an impact on the working environment in hospitals and outpatient care and physician decision-making. However, there are ethical and social issues from information and communication technology in healthcare. The use or even failure to use of a machine can make the patient's healthcare, their doctor visits, and everything else related to their experience at the clinical office suboptimal. There are many benefits of ICT for patients. There are diagnostic devices like the CAT scan. There's an efficient patient data system with a storage, retrieval, and exchange of patient data in an integrated care network. The linkages would allow the transfer of patient data from one care facility to another. And computer software vendors have developed systems to streamline record keeping and administrative functions. Next, it improves the quality of patient care, it advances medical science, and it enhances the education of healthcare professionals. However, there's a negative side of ICT. The drawbacks are mainly a result of the interactions of IT with other structural determinants of healthcare, such as the physician reimbursement system. For example, for electronic billing, it can allow some physicians to up or downgrade diagnostic code to increase personal income. More in-depth examples are illustrated in the following slides. Patient information. The positives. It can be a source of important data for insurance reimbursement, and it can assist in monitoring quality control of healthcare delivery and provide resources for medical research. The negatives, however, can lead to unlawful disclosure of personal information by trusted insiders who, motivated by financial incentives to supplement their income, sell personal information. It can be an invasion of privacy. Health information and the medical record include sensitive personal information that reveals some of the most intimate aspects of an individual's life, including family history, genetic testing, history of drug use, STDs, whatnot. Also, healthcare information can influence the decisions about an individual's access to credit, admission to educational systems, institutions, and his or her ability to secure employment and obtain insurance. The next example we will use is genetic information, the use and the ownership of it. Positive, it can diagnose hereditary diseases, and there's an opportunity to select certain therapeutic interventions based on genotype. Negatives, employers and insurance companies, the question lies, do they have legitimate access to genetic information? Who owns and controls it? Typically, the answer should be that it should only be accessed by medical professionals, and the patient should be the owner. Now we will go on to answer the question, how does and will IT transform the medical construction of the human body and disease? And what are the issues that we need to address? Virtual realities and simulation. Positives It helps in the teaching and training in medicine. It uses human-like artifacts, full-body anatomy. It trains new practitioners, prevents harm, and provides benefits for patients. And it's ethical for training of clinical skills using mannequins. The negatives: it will always fall short of what actually happens in patient care. To combat it, one must understand the limitations and spend as much time as possible with real-world patients. Virtual reality should be a supplement, not a substitute for teaching. Next off, use of constructive technologies. Modern imaging technologies like magnetic resonance imaging or positron emission tomography provide realistic insights into the human body. Negatives: they are highly constructive artifacts that result from a combination of model-driven algorithms, computations, and visualizations. The images are interpretations, not 100% depictions of reality, which, at the present time is somewhat impossible. Standardizing the brain functions is difficult since there are many cerebral structure variations among people, for example. Another example, neuronal motor processes, which connect the brain with the computer through brain-computer interfaces. Positives: it helps paralyzed patients. It connects nerve fibers with microtechnical devices and restores limb functions. The negatives: implanted electrodes of input component that registers the cortical field components can alter a patient personality traits in an unacceptable way. And there are risks for patients due to the malfunctioning of systems. The last example we have for you today are the electrodes in the brain, or deep brain stimulations. Positives: it controls the function of brain regions, for example, tremor control in Parkinson's or OCD, obsessive compulsive disorder. The negatives: it can lead to infections. It can lead to adverse neuropsychological affects the character and personality traits. In general, it should be restricted to severe disorders when other less invasive treatments with comparable effects are not available. There are certain ways to combat unethical ICT practices in healthcare. Be familiar with strengths and limitations of the IT systems you're using. Be aware that new approaches to data protection must track the flow of the data itself. And for patients, restrict access to your health information outside the medical sphere, but also be aware of how your information is used in the medical field as well. Here are some links to web resources that have a lot of great information on ICT and the effects of it on healthcare. The first is from the International Review of Information Ethics, and the second is from the Computer Professionals for Social Responsibility. And that concludes my presentation. Thank you so much for your time today, and I hope you have a wonderful day.